one of the top devices that we are featuring today is Silkro. The device is so fast and it's so easy. And let me show it to you right now. The device allows us to, would you mind grabbing one of the tips? Lizzie has it. Yes, please. Oh, here it is, Jason. So really, radio frequency is where it's at. So these come in two different types, 49 and 25 tip. This is a 25 tip. I like the platform where the end of the device is one that is not too bulky. The handpiece is nice and light, and we're not going to worry about losing spaces and having to go back because the whole interface between the device and the patient is nice and tight, meaning there's not extra plastic laying around that's making more space that is not treated. And so this is a very elegant, motorized, and super fast RF microneedling device. The neat part about this is that we can modulate exactly the speed of the needle entry. We can modulate the level of coagulation or energy that's being delivered by the needles, and the pace, obviously, that we're doing all of this. We can adjust it per patient every single time, or more importantly, we can really deliver a treatment that is the best treatment for all of our patients. And what do I mean by that? When we've been doing all of these RF microneedling treatments, we found that every device has its sweet spot. And it's something that I think all of us in the industry know, this device at this radio frequency or this energy level is the best, it gives me the best results. And so what we did was we went through a number of patients and developed a protocol for the different areas of the face, because obviously the forehead is going to have a different treatment protocol compared to the cheeks. And so all of these have been pre-programmed so that we have at the forehead, the first depth that we're going to do a treatment at is at 1.1 millimeter depth, and then we're going to move to the second pass at 0.8 millimeter depth, and then the third pass at 0.5 millimeter depth, going from deep to superficial, and allowing us to get a perfect treatment for the forehead. Now, when we go to the cheeks, it's a completely different treatment. It's 2.5, followed by 1.9, followed by 0.9. And this is typically the best protocol for all patients involved. Now, we were able to get all of this information because of the fact that this device logs all of this information for us. For many years, we've been doing radio frequency microneedling, and I really didn't know exactly what the estheticians and nurses were doing. They were doing 1 or 2 or 3 passes on certain parts of the face at different energy levels, but the documentation was never as accurate as the treatment. And they were getting great results. But now that we can have the ability to work with a company that is able to download all of the treatment information, not just to our interface here, but to the cloud, we're able to maximize the quality of outcome for all of our patients and see what everyone else in the world is doing with respect to better outcomes or better protocols that we're not aware of. But for now, this is what we're doing, and it is remarkable to see the speed. Now, the RF microneedling devices are going to start separating themselves, and they're going to be separating themselves based on the incorporation of biologics. Well, we've seen other companies that are infusing or pushing exosomes into the skin with suction. Silkro is going to be the device that's utilizing plasma energy that's going to be coming out later this year to be used in conjunction with radio frequency, RF microneedling radio frequency energy, to allow for the greatest penetration of these exosomes that are being used now ubiquitously in med spas in the US and really, truly, I think except for Europe, worldwide. What we noticed preclinically is that exosomes are able to enhance the formation of collagen and elastin starting at day 3. And so if you apply a device like Silkro on top of the skin, we're going to have an increase of the penetration of these exosomes. And that's when we get those wow results. The combination of the right device and the right biologic in the future is what all of these medical device companies are striving for. And this happens to be, again, the fastest and easiest RF microneedling device on the planet right now. And with the data informatics that allows us to get consistent and predictable treatments every single time. I can rest assured that every one of our practitioners in our clinic is doing the same thing every single time to get that predictable outcome that we charge a lot for, but we expect to have that outcome every single time. And if we don't, we'll figure out why. The technology is one where the plasma technology has been shown to have an increase in penetration of the cytokines and growth factors. And the deeper we can get that product into the tissue in conjunction with the right energy, the better the outcomes will be. Let me go ahead and start the presentation for Silkro. So we're going to get you, put you on hold for just a moment. Here you go. So I wanted to show you the before pictures of that patient that we have right there. This is the cellulite that we were treating with Ovally.
Sharing your screen, not the camera.
Before we start our Silkro presentation. And so here we are, that's the cellulite that we're treating with the Ovally on this patient that we just saw. And this is the saddlebag reduction there that you saw with Ativa with the subdermal coagulation. Pretty remarkable, no downtime, immediate presentation on the skin without liposuction. So let's go ahead and talk about Silkro. So again, I think there's three leading devices right now in the industry, and they're going to be the devices that are the gentlest, fastest, and are giving you the results with the energy that we're delivering. I like to work with companies that are going to send us patients, meaning when we were working with Cool Sculpting, it was great to know that patients would call immediately and ask for cool sculpting. And so the fact that Silkro is gaining significant traction in the press is very positive for them. The device is really 5 technologies in one. So when you're looking at devices, we like to get the biggest bang out of the buck. And so we're able to do a number of treatments other than just RF microneedling. Then we're probably taking advantage of our estheticians' time with respect to the upsell of other treatments, including vaginal tightening, including acne formation, including other skin tightening applications that exist with Silkro. And so the Silkro platform is the only RF microneedling platform that adds in all of these treatment potentials to hopefully help treat more of your patients' issues and really become a revenue generator. The RF microneedling comes in 2 flavors, insulated and non-insulated. We're very aggressive, so we do a lot without the insulation tips, but early on I recommend, especially if you're not using biologics, definitely use the insulated tips, and they're also more comfortable for our patients. I was talking about this a little bit. Notice that the handpiece is one that allows us to get these 25 needles into the skin without that big of a platform, or without that big of a plastic piece where a lot of the handpiece is void of any of the microneedles, and that sometimes leads to unequal treatment where there's some spaces between the different depths. And so we can have great estheticians, but if we put great devices in their hands, our patients are going to have better results. The QuagPro technology is their patented technology, and it's allowing them to achieve the tightening effects that we're seeing, and you'll see some before and after pictures that are absolutely remarkable. The Silkro Precision comes in 3 different sizes for comedones and some other acne treatments. We haven't used this very much. We don't have as much of an acne population, but certainly when you're wanting to be more aggressive and more precise, you want to load all of that radio frequency energy onto one needle as opposed to dispersing it within 25 or 49 needles, and really get to the root of the problem, which is the inflammatory cycle of some of these sebaceous glands. Finally, the radio frequency for the external and for the vaginal hand pieces within the Silkro make this device a great device to purchase if you're just getting into the RF microneedling game, or you're wanting to add in one more RF microneedling device, but to take greater advantage of all of the other applications that it offers. This is the best part. The plasma device that's going to be coming out with the Silkro system is one that's going to increase the potential absorption of the topical cosmetic serums that you're using. We recommend that you try them all out. Try the adipose-derived, placental-derived, bone marrow-derived, and umbilical cord-derived stem cell exosome products, or any other collagen building and boosting. But ultimately, the outcome that you get is going to determine the price that you charge for these treatments. And we typically charge $1,900 for one RF microneedling treatment with 1 vial of exosomes. And the results are pretty remarkable. We have done split face studies to show where RF microneedling done full face is definitely visible when we apply an exosome product or stem cell product to only half of the face. And after 3 months, the results are undeniable. And these studies have been performed on split face for a handful of patients. It was 30 patients. And so ultimately, this is going to be what separates this device from the other devices in maximizing the outcomes in conjunction with biologics. We talked a little bit about the integrated software. The neat part about it all is the cloud technology. We've been talking about doing blockchain technology with a lot of our partners so that we can find out exactly who's getting the best results, what the common trends are, and how we can incorporate that into our practice without having to wait for a lecture that's 2 years old. So today's technology, these lectures, for example, this technology you're not going to see until 2024 in the lecture circuit. But if we can get that same level of data downloaded into our systems, so we know what is the best protocol for our patients, we're ahead of the game. And then if we can use that same information or technology to upgrade our devices, to save our protocols, to remind us to order hand pieces, to prevent any issues with use because of malfunction, and know that the system can be monitored and repaired or enhanced during the workday through simple cloud technology. That makes our day of RF microneedling treatments a day that we don't have to cancel. A canceled day because of a device not working, a big problem. And so we're really excited about the ability to be able to have a faster support service from Silkro with their cloud technology in our practice. Let's get to the device as well. The platform is easy. We've gone ahead and put in all of our settings, and so if you're purchasing this device, you're going to be utilizing all of our RF microneedling settings throughout the face. We're going to be adding in a few other advanced settings depending on the biologic that you're using. They're not all made the same. We've done split face biologics with RF treatments and have seen dramatic differences with the same treatment performed by the same esthetician on right and left, but different biologics between right and left, and the outcomes are different. And so because of that, we need to determine or change or customize the protocols that we're delivering to you because not every exosome product is the same. But let's get to the meat of the issue and let's look at the results. Pretty remarkable. This is after 2 treatments. We like to see as big of a result immediately as possible. I don't like buying a device, having a treatment done, and being told, well, we have to do 4 more treatments, and then we have to wait 3 to 6 months to see the results. I want to see immediacy. And so here we are after 2 treatments. Here we are after 3 treatments of Silkro with the microneedling. Really remarkable control of the inflammatory cycle. Here we are with a little bit of the skin tightening effect that you can get with RF microneedling with the contour changes. And again, this is skin texture, and the neat part is you can include this with surgery because of the Quad Pro technology. It's going to be a safe delivery, and so we are doing our surgical facelifts and then adding in RF microneedling safely on top of this to get an even bigger result, or Ativa to get an even bigger result than just RF microneedling alone. But if you're a medical spa that's wanting to get the biggest bang out of the buck, make sure that you have a device that's going to deliver results in the most commonly performed treatment with these devices, which is RF microneedling to the face. And here we are, some pretty remarkable outcomes. Again, control of inflammation, skin tightening after just 2 treatments. Here we are with neck improvement after 3 treatments. Really remarkable. And I think that the combination platform of deep Ativa followed by superficial Silkro is going to be a nice platform for our patients, which we've already experienced in our clinic from some of the first pictures that we showed you. Here we are before, after 4 treatments. Obviously, the more rhytids you have, the deeper they are, the more treatments you're going to need. But again, if you start adding in biologics, particularly with that plasma handpiece, we're going to be able to see some of those treatment numbers come down from 4 treatments down to 2 treatments, and hopefully even just 1 treatment. So pretty remarkable in terms of the outcomes. Again, we've used just about every RF microneedling device. We have 4 different companies here in our office, and right now, I think our estheticians like Silkro the best. And they just say it's safe, it's easy, and fast. That's their take on it. I just love the predictability, reproducibility, the data. I want to make sure that my estheticians are doing the same treatment every single time, confidently knowing that we're delivering results. And this is the kind of results that Silkro can offer our patients. We haven't done any of the vaginal tightening device yet. We just don't have that practice. But for those of you that are wanting to include that into your practice, this is a nice platform to get not just the RF microneedling that I think is a staple in every single aesthetic office, but you can expand into other aspects given your patient population. So, what questions do you have about Silkro right now?
No questions yet coming in. They wanted to see the applicator firing.
Oh yeah, we're just about to finish. So we just finished the full face RF microneedling the Ativa subdermal coagulation treatment. And we can see that the patient looks beautiful. We're going to go ahead and now do the overlay. And so RF microneedling, depending on how you set it, can do things like decrease the redness from coagulating those microvascular. Are you okay there?
Yeah, I'm ready.
Okay, all of the microvascular and pigmentary changes in the skin. And so here, now that we've done the Ativa, and you can see there's no downtime, we're gonna go ahead and do the Silkro right now. Can we add in the next camera? How are you feeling?
Good.
Want to switch over to the
This is a lot of information, everyone. Sorry that we're doing our full practice regimen here, but I'd rather you guys get the biggest bang of your buck first. And so we're gonna limit her treatment to her cheeks primarily. And what we're gonna notice, and we'll be able to post these pictures after her treatment is done later on, is you'll see how much control of the underlying redness she has with the radio frequency. And so here we are. We're going to start. It's already preset. It's so simple that even I can use this, and it's pretty quick. We're at a repetition of 0.3, a depth of 2.5, and we can change this anywhere as low as 0.5 and as high as 3.5. And our radio frequency on time and delay time have been adjusted to complement the Ativa treatment for this case. We have a power of 5 right now, and we're ready to go ahead. The neat part, this is going to go quick, and you're going to notice that I'm going to press one time. How's that feeling?
Okay. I feel it.
So this is nice and fast. Notice that I don't have to stretch out to reach the foot pedal. Everything is already set. Like, this is the Pro device. My esthetician, you guys go at 0.2, even faster? Yeah. They're younger.
That was one of the questions compared to other RF microneedling devices you've had. Is this one of the fastest, or is the fastest?
This is the fastest. And patients can only tolerate so much. Okay, so there we've done the cheek treatment. We're going to go ahead and go into mode 2 right now, and so it's already preset. It changes the depth, it changes the RF on time, delay time, and we're able to do our second one. And so you can imagine what my estheticians can do. They can do a full face in just minutes.
They are asking after a break to see max speed, how fast that is.
All right, I'll do max speed. Now you guys are testing me. Ready? You guys forget, this is where I started a long time ago as a young, broke.
After 20 years.
Yeah, it's actually really nice and light. It's easy to use. Even the surgeon likes it. That's probably a good selling point. And I turn it off, turn it on with one click, turn it off with one click.
Finish the cosmetic procedure.
And now we're going to do mode 3, our more superficial one.
Start the cosmetic procedure.
Can you warm up some exos? And here, I'm going to just, do you guys remember how much movement she had before? This is absolutely incredible. This is after Ativa. Now I'm doing that superficial skin. Let's get really high right in here. I'm going to lift all of the skin. This is the superficial treatment. There's going to be a little smarty there, okay? Sharon?
Yeah. Oh, yeah, I'm good. Sorry.
While you're doing that, I know you can do 2 or 3 things at once,
Yeah.
but all skin types, right, with the
All skin types.
insulated needles?
Yep. There we go. And so I know I've delivered all of the energy that I wanted to deliver without sacrificing the quality of the skin. Look way up for me. I'm gonna just do one more pass right here. So when we first started this, we used one device whose name I won't mention. Oh my God, it was like a stapler on people's faces. And again, if you can't finish a treatment on a patient, look how slow 0.3 looks now. So let's go back up to 0.2 seconds. And that was 3 passes. So it's taking a little bit longer because we're going deeper at 2.5 millimeters of depth.